Assalamualaikum and hi everyone. My name is Liyana binti Rosli and a 4-year degree student of University Science Malaysia. I'm studying in physics and majoring in medical physics. In this video, I'm going to discuss and explain about ultrasound guided fine needle aspiration biopsy of the thyroid. The title is long, is it? But it's okay, don't worry. I will make sure that at the end of this video, you will understand about this title. So, don't go anywhere, stay tuned for more info. Before I'm going to details, have you heard about biopsy? I bet that some of you may hear it or some maybe not. So, what is the biopsy? So, the biopsy is the removal of tissue in order to examine it for disease. The tissue sample can be taken from any part of the body. Biopsy are performed in several different ways. Some biopsy involve removing a small amount of tissue with a needle, while others involve surgically removing an entire lump or noodle that is suspicious. Okay, now let's back to our topic, which is ultrasound guided fine needle aspiration biopsy of the thyroid. What is ultrasound? Ultrasound imaging is an invasive medical test that helps physicians diagnose and treat medical conditions. It produces a picture of inside of the body using sound wave. Ultrasound imaging is also called sonography. It uses small probes called a transducer and gel placed directly on the skin. High-frequency sound wave travel from the probe through the gel into the body. The probes collect the sounds that bounce back. A computer uses the sound wave to create an image. Because ultrasound captures image in real time, it can show the structure and the movement of the body's internal organ. And you want to know the interesting facts that the image also can show the blood flowing through the blood vessels. It's quite interesting, right? As for ultrasound of the thyroid, it produces picture of the thyroid gland and the adjacent structure in the neck. Before that, do you know where the thyroid gland is located? The thyroid gland is located in front of the neck, just above the collarbones, and it's shaped like a butterfly with one loop on the other side of the neck, connected by a narrow band of tissue. And you want to know that a thyroid gland is the one of the 9 endocrine glands located throughout the body that makes and send hormone into the bloodstream. Ultrasound guided fine needle aspiration biopsy of the thyroid. So, during a fine needle aspiration biopsy of the thyroid, a small sample of tissue is removed from the thyroid gland. A needle biopsy, which is a needle aspiration, uses a hollow needle to remove a tissue sample from a suspicious area for lab analysis. Imaging exam often detect nodules or abnormality within the body. However, this imaging test cannot always tell whether a nodule is benign or malignant. Before that, what is benign and malignant? Benign tumor is the cells are not cancerous. It won't invade a nearby tissue or spread to the other area of the body. And as for malignant, it means that the tumor is made of cancer cell and can invade a nearby tissue. Here in picture here, you can see the difference between benign tumor and the malignant tumor. Have you ever wondered how the ultrasound guided fine needle aspiration biopsy of the thyroid is work? Don't worry, I'm going to explain and show you the procedure of this process. Now, I will show you a video about the procedure during biopsy process. Here, you can see the equipment involved during the biopsy process. The chair will recline to put your head back into the position. The doctor will use an ultrasound probe to find the thyroid nodules and measure its blood flow and stiffness. Then you will extend your net and tilt your head. After cleaning the skin over the nodules, the doctor will numb your skin with the medicine given through a tiny needles. About 1 minute later, the doctor will use the same size needles to collect a tissue sample for your nodules. The doctor can see the needles on the ultrasound screen at all times. Each biopsy sample takes only 3 to 5 seconds to collect. This process is repeated once or twice for each nodule to get tissue from different areas of the nodules. During each samples, try to stay calm and breathe easy. After the procedure, we will check your blood pressure and you press gently on your neck for about 5 minutes. You can do your all normal activity today after the biopsy. Advantages of ultrasound-guided fine needle aspiration biopsy of the thyroid. The first one, the result of the needle biopsy of the thyroid are close to 95% accurate for adequate biopsy. A second one, a needle biopsy is a reliable way to obtain tissue samples that can help diagnose whether a nodule is benign or malignant. And the third one, a needle biopsy is less invasive than open and closed surgical biopsy. And the last one, recovery time is also brief and patient can soon resume their usual activity. However, even though it has an advantage, it also has disadvantage. So, disadvantages of ultrasound-guided fine needle aspiration biopsy of the thyroid is, the first one is the bleeding at the site of the biopsy. And the second one is infection. And the last one is injury to the structure adjacent to the thyroid. In conclusion, ultrasound-guided fine needle aspiration biopsy of the thyroid is used to know whether the thyroid nodule is benign or malignant. So, ultrasound is used to guide the biopsy process of the thyroid. As we know, we can see the movement of the organ by using ultrasound. Thank you for listening and watching this video.